Good morning, Pete Storey, Director of Recruiting and Program Development for Regional Healthcare Network, our guest. And Pete, hadn't seen you in a little while. What's been going on with you, man?
Good morning, Jimmy Dale. I appreciate the opportunity.
You neatly dressed today for the fall
only
season.
Only for you. I tell you, every time I come over here, it's only for Jimmy Dale.
I'll tell you.
That's right.
You're the Director of Recruiting and Program Development for Regional Healthcare Network. Exactly what this is and what are you doing?
Well, the Regional Healthcare Network is actually a nonprofit that formed out of the Childersburg Primary Care in Childersburg with Mike Bice. And when I was the chamber president, really about the time I went to work is when Mike formed this network. I think it was first called the Childersburg Network, Healthcare Network. Mm-hmm. And so I got involved with it there. He needed our city's medical board involved to get some things done and get the nonprofit set up. So been involved with it through the years with that. He put me on the board of directors, and of course the chamber did a letter of recommendation, whatever, and supported it through the years. So there's several things that this network has done in the past. Just to give you a brief history of it, they bought some AEDs, replaced them, placed them throughout rural Alabama. It's all about rural healthcare network. And so that was one of the things they did. They created a wound care center there with Dr. Spear as certified wound care doctor now. That was a big part of it. Some federal grants that was done. Our Congressman Mike Rogers certainly helped with all of that. So that the network is all about improving the healthcare network in rural Alabama. Now, it's not in the true sense of a network like some of the other ones are that are big and have members. We're trying to get there. But Mike has just really looked at different grants that could improve the healthcare here in rural Alabama. Mm-hmm. And so what he's done now, he found this grant a couple of years ago, applied for it, and received it. We received one of 15 national grants in what we're doing now. And it's called HIT, Health Information Technology. And he received this grant sometime last year, and I remember when we got this, because I was still at the chamber at that time, and then of course I left about a year ago, and he progressed with it then. But what we're doing, we've actually got a federal grant to get people certified and trained in health information technology, mm-hmm. which has to do all with health telemedicine. Telemedicine is a big word. I'm sure a lot of people have heard that. When you go to the doctor now, most of them are putting all your records on the computer.
Yeah. So
that's a different type of software that has to be maintained, implemented, and of course it's just like any other software. Things happen, computers go down, and there's a lot of different vendors out there that have created this software. So there's certain types, different kinds that the different clinics, hospitals can purchase. But even with all of that, you still have to have these IT people that can maintain it and work with it every day.
And Central Alabama Community College is going to be the venue for the technology curriculum and trying to get more kids plugged in and help secure their futures.
That's right, and that's what I like about it. I just went to work with Mike right after Labor Day. And right now we are in the recruiting stage. It will always be a recruitment activity, but we have partnered with CAC. Actually, UAB is a partner with us also. They helped write this curriculum with CAC, with mm-hmm. their dean and their health departments there. I know Dr. I'm trying to think of some names now. I'm going to go blank because I don't have notes in front of me. Melanie Bolton, Dr. Bolton over there at CAC was a big part of that, and Dean Spears has come on board. But, CAC is where we have classes set up right now to where they can go to school. There's some online classes through UAB, and some of these classes are online at CAC also. They chose to put the curriculum that UAB helped create under their, what they call their OAD program, the Office Administration. So right now it's up under that, which, these people, once they get certified, take these classes, there's a certification test that they'll have to pass after that. And so they will be working in an office environment in a clinic, doctor's office, rural hospital. So they do need some office type classes to, to get them trained for that. So that's the reason they put it under their OAD department. But yeah, CAC is where we have our classes set up. We have 9 students enrolled right now. That was done before I got here, and hopefully that's going well. We keep in touch with them, trying to keep in touch with them, and it's just what I was going to say is what I really like about it, and it goes back to my chamber days, I guess, is that it's some workforce at the tail end of it. It's education / workforce, which we tried to, you're always trying to improve that in your community, and it's all about rural Alabama too. Now we're trying to gear everything toward the rural, but I was looking at it yesterday. There's 12 counties in the state that are not rural. 67 counties, and only 12 of them are considered urban by the federal government standards. So the door's wide open. We're concentrating. Our region right now is East Alabama, pretty much in line with the East Alabama Regional Planning Commission's region is our pretty much target area right now. But not to say that we couldn't place somebody in a rural setting somewhere else. We certainly are going to have that capability, but we're just concentrating on right now in this eastern part of the state, just because that's where we're at, and we have more contacts there. So
there's a lot of competition for jobs in the market. A lot of people are looking jobs for their future, or maybe they're wanting to change their future as far as the job market is concerned, and you're taking applications. Got some recruiting going on right now for this curriculum.
That's right, and you're right. The IT job market is wide open. I mean, that's still, I think, one of the top 10 jobs out there, and this health HIT is one of the top 10 jobs too. And everything is on computer now, so it is a wide open market. And this telemedicine, some of this stuff is mandated by the Obamacare Act, and so that's where a lot of this has come from. That they've got to get on these systems, whether they really want to or not.
I was about to say, whether you like it or not.
Whether you like it or not, they've got to do it. So the job market is wide open. It's going to be a great career for these people that decide to go into it. And, one of the main people we're looking at are students already enrolled in community college, because I would say probably, I don't know about the majority, but I'm 50 to 60% of those kids right now don't have a clue what they're going to do, which is okay. And that's what I tell them all the time. It's okay. And when we worked with our high school kids when I was at the chamber, it's okay that you don't know. There's nothing wrong with that. But now we've got a tool and it's something that we can lead them and show them a great career. So we're all, veterans is one group we're also looking at. So if anybody's out there listening to us this morning, everybody, and I know it goes all the way up to the federal line that, we want to put our veterans back to work once they come back from Afghanistan or Iraq or wherever they're going. And so veterans is a big target for us, and that's sort of mandated by this grant. They're telling us we really want to, look at the veterans. So we're really, as a matter of fact, I'm going to a veterans job fair Friday in Anniston. Got one next Tuesday up at Redstone Arsenal. I've been to Fort Benning in Georgia. So we're really looking for ways to find veterans. I went to the Veterans Day program in Childersburg yesterday, hoping that I could find some people there and let them help me. The American Legion Post 68 presented a program yesterday. So again, if any of you have relatives or just know of veterans that are getting ready to get out, get them to contact me, because we've got a great program. Right this minute, as of today, I'm not 100% sure that the GI Bills will pay for this, but it's almost just a formality that it will. Just there's some approval processes that has to be done. So, and we're getting ready to offer scholarships to these students. It'll be on the back end. They'll have to pay for everything up front, because we want a commitment from them that they go through the program, get certified, go to work. Once all of that is done, we're going to be able to come back in and reimburse most of, if not all of their tuition and all. But it's at the end of, it's only a 9-month course at CAC. So it's only 3 semesters. We've got an internship and preceptorship set up that once they get certified, we're going to help them get certified too. I've been able to get my hands on some sample tests that they'll have to take. So we're going to be able to work with them. It's not like we're trying to get them in school and just leave them alone like most people do. We're going to be there throughout the whole process until they get a job. We've actually got a job placement director that will come in at the end and help them find jobs.
So what do people need to do to find out more information on this program, and when can they get started?
Well, they can get started. We've got a next set of classes starting in January at CAC, so time is of essence right now. The registration starts first week of December at CAC. Now you can register all the way up to the first day of classes at CAC, and that's first day of classes is January the 12th. So you could register all the way up to that Friday for classes. So we've got a website, www.rhcn.org. That's Regional Healthcare Network. We're on Facebook. We got a Twitter account set up. Do you do Twitter?
Oh yeah.
You do?
Oh no! I thought it was a bird. I thought it was a bird.
I need some lessons.
I've heard
on
about
that.
it. No.
I've got a Twitter account set up, but I don't have to figure Twitter out.
I'm just glad to tie my tie.
I know, me too. But we're pretty active on Facebook. I try to keep that updated and posted. So go to our website, go to our Facebook page, which is Regional Healthcare Network. My phone number at the office there is 256-346-3441. You can call me. My cell number is 256-510-0027. So get in touch with me there. My office is at like I said, the clinic there in Childersburg Primary Care, which is right next door to CAC. But yeah, there's information there. I can email you things. We want to try to interview everyone that is really interested in this, because there are some details that is time constraint to give them today. But really want to concentrate on the internship and the preceptorship too, because on the internship, once they graduate from CAC and get certified, we've got about a 2 or 3 week opportunity there that we're going to give them some real life work on may not be the exact system that they will be working on in that doctor's office or hospital, but it will be one that is real similar to that. So I'm excited about that. We can give them some real world experience on that. And then preceptorship, we'll be working with the different clinics and hospitals to get them placed there to actually have about 10 weeks of working there until it's time to actually go to work and start getting paid.
Pete, there a lot, and we saw this just this week, a lot of veterans in our community. And in East Alabama, these men and women are war tested. They serve their country well, but to be honest, some, they don't really have a clue how to, go about in the world of technology today. This can be helpful to them, and, there's federal funds for this.
There's federal funds, and I think that's one reason probably this grant is sort of dictating us, recruit veterans, just what you just said. And, those people are the ones that most likely will be the ones that can just go right in and go to work. Some of them are going to have health backgrounds. Some of them been medics in the Army or whatever they've been in. Some of them going to have the IT. You put those two things together, and it wouldn't take them long at all to pick up on what we're doing. And some of it, they may not have the medical coding and the medical billing part of it. That's what we're going to teach. That's what they're going to learn in these classes, and that's all part of it too, is the coding and billing that goes along with it. But yeah, I'm excited about trying to get out there, and that's been a little bit of a problem for us, to be honest with you, is finding places where the veterans are going to once they get back, that they get help. Now there's agencies set up to help them, but it's been a little bit of a struggle, to be honest with you. We talk, you don't want to be negative or anything, but the VA is the VA, and sometimes it's hard to get people to call you back or email you back from the VA. So, but we're excited about the opportunity. I I'm back doing what I like doing, is being out and talking to people, and especially, like I said, trying to get people educated in the workforce. It's just been a blessing that God has just laid in my lap. I'm just telling you.
Well, your and my life, especially mine, in the twilight years, I've lived a long time on this earth, but there are kids that are coming up. They're going to have to step in the trenches, so to speak, and this is something that can really help them in the workforce and help our communities as well.
Yes, and the other aspect of this to me is, and we want them to do this, but think about the possibilities that this could lead them to further in their career. You get, everybody's thinking healthcare, because it is a great industry right now. And whether, you don't have to be an RN, or you don't have to be a nursing
LPN
or whatever. This will help them start a career that no telling what it could lead to. Absolutely.
All right, again, how can they find out more information and get going?
Find out, my phone number is 256-346-3441. We're on, my website is www.rhcn.org. We're on Facebook, Regional Healthcare Network, and you can call me and find out more information there, and we'd love to talk with you.
Don't tweet him, whatever you do.
That's right.
Pete, always a pleasure, sir.
Thank you, Jimmy Dale.